Hi everyone, welcome back. As some of you may know, I have experience, not only medical experience, but experience also in treating physical disability in children. So that's what I'm going to be talking about today. I am going to talk about how massage can help children with juvenile arthritis. Now, this is something that's not known to a lot of people, unless you have personal experience of it. People tend not to really know too much about it. In fact, juvenile arthritis is actually an umbrella term for various autoimmune conditions and inflammatory conditions in children below 16 years old. Some of these conditions, it will include juvenile idiopathic arthritis, which is the most common form, juvenile lupus, juvenile scleroderma, juvenile dermatomyositis, fibromyalgia, Kawasaki disease, and also mixed connective tissue disease. Now, I'm not going to talk about each one of these in detail or anything. This is going to be more of a general post as to how massage can help. So I'm going to focus on the most common, juvenile idiopathic arthritis, and I'll also briefly mention the lupus and the Kawasaki. Alternative therapies such as massage can be used to ease the symptoms and really just help improve the quality of life of children with these conditions. As we know, any childhood disability can really impact not only physically, but also on their social life and how they interact with other children, how they feel about themselves. And we know that massage can certainly, just in the relaxation effect, can really help them deal with stressful situations more effectively, to boost their self-confidence and self-esteem, which will help them in social situations, and just generally improve their quality of life and help them have hopefully a more positive sort of outlook with regards to their disability. So in terms of the symptoms, every type of juvenile arthritis will have different symptoms. And obviously every individual as well is different, and, some, won't get all of the symptoms. It will differ, with each individual. But certainly pain and inflammation of the joints is common in all of those conditions that I listed earlier. In addition to the effects on the musculoskeletal system, juvenile arthritis may also affect the skin and the connective tissue. It may also affect the eyes and the digestive tract as well. But massage, as we know, it can work on connective tissue and numerous benefits to the digestive tract. If you've seen my video on abdominal massage. So by working on those, it can really help improve symptoms around the pain and the inflammation, and any digestive issues, and, which in turn will help with any, issues of fatigue and reduced energy. As we've said, there are different types of juvenile arthritis. Symptoms generally on the juvenile idiopathic arthritis, as we've said, pain, joint inflammation, changes in bone structure as well, inflammation of the eyes, and also sometimes psoriasis of the skin surrounding those joints that are affected. Now, I've also done a video about how massage benefits psoriasis and psoriatic arthritis. So it may be worth you looking at that video also. Yeah, so as we know, also massage, promotes the production of new mitochondria, which, again, if you've seen my video on physical benefits of massage, you'll know that this increased production of mitochondria, which is a part of each, the body cells, that in turn will actually help to reduce inflammation in the body and therefore pain as well. So also sometimes another symptom may be fever or rash as well. So potentially, obviously if a child's got a fever, a massage treatment would be contraindicated, but when it subsides for all those other symptoms, there's definitely, benefits. So those are the main symptoms, but also in something like Kawasaki disease, not only do you have the inflammation of the joints, but also inflammation of the blood vessels, and possibly, heart-related conditions. So again, the effect of massage on the circulatory system, can really just help calm down, any inflammation on those vessels. And also with lupus, that's again, sort of similar symptoms, but where lupus differs is it potentially affects pretty much every system in the body. So it can affect the skin and the blood vessels and the joints, but also the lungs, the brain, and the kidneys as well. So through massage's impact on the immune system, it can just help calm down, the body's systems and just help with all that inflammation and everything else. So whatever the type of juvenile arthritis that your child has, it can significantly impact on both childhood and adulthood. Maybe your child is having to miss school, or they're not able to take part in sports, which, in turn can then worsen those sort of arthritic symptoms. There's going to be, as we said, psychological and social issues. Quite often children with disabilities, they feel different, they feel left out, and they may find it hard to, form and maintain friendships. And sometimes other children may not understand, exactly how much that child has to deal with. So, that can lead the child to become depressed, have low self-esteem. But as we know, massage helps to, increase the release of those feel-good endorphins, your serotonin, your dopamine, which helps lift depression, and also help boost the self-esteem. And also abdominal massage as well, by working around the sacral chakra and the solar plexus, can really help, improve self-confidence and just kind of generate a more optimistic outlook on life. Which in turn can help that child to just deal with their disability a little more easily, and just cope with stress, caused by their symptoms in a slightly more positive way. So while there isn't a cure for juvenile arthritis, treatment can help ease inflammation, ease the pain, and it can potentially bring about a remission. Common treatment plans would involve things like stretching and physical activity, which is, we've just sort of said, quite often children may have to miss out on sports, because of the symptoms, but, actually that can then worsen the symptoms. So it's like a vicious cycle. Medication, they may have some form of eye care, especially in the scleroderma type. Occasionally they may have splints or orthotics, just to help support the joints, and try to help reduce pain and inflammation. But certainly massages, we know it has been shown to be a very effective form of treatment. So as I've touched on in this video, for its ability to decrease pain, to ease inflammation on those joints, and that happens through the sort of improved circulation, bringing oxygen and nutrients to the tissues, improved lymphatic flow, which, with the immune system, it helps work on inflammation and healing of the tissues, and also that increased mitochondrial production, which again will really help, lower levels of inflammation. Massage will also help by reducing those stress and anxiety levels, through inhibiting the cortisol and the adrenaline, those stress hormones, which in turn will help the person deal with their disability in a more positive way, and just be able to adapt as well. If anything changes with their disability, they'll just be able to adapt to those changes a bit better. And in terms of just that relaxation effect, again, that can just make so much difference in sleeping patterns, if you're not sleeping because you're in pain, and in your own self-esteem, and in how you relate to other people as well. So, and of course, if there is an element of depression, just through the daily stresses of having a disability, those increased levels of serotonin and dopamine, as I said, will also help improve the mood. One thing to say is that massage would not be used directly on affected areas, so any like painful or inflamed joints, massage will not, those areas will not be directly treated, but the massage will still activate, certain systems of the body, for example, the lymphatic system, the immune system, which we've talked about, how they kind of ease inflammation, so they can assist with joint decompression, which again, will benefit anyone suffering a lot of pain. Also heat and cold therapy, that can be used in conjunction with massage to further improve pain levels, whether that be through, hydrotherapy. Quite often with childhood disability, you'll, have physiotherapy input anyway, and they can refer you for hydrotherapy. So just the heat of the water, doing the exercises in the water, which takes the pressure off the joints as well, that can really help. But also just using like hot compresses and ice packs. The ice packs will help reduce inflammation. The hot compresses will help, relax the muscles around the joints and help ease pain. And they can be used directly on those arthritic areas. So, it kind of complements, maybe where the massage can't work directly. In terms of contraindications, as we've said, no direct massage to specific areas because it might increase pain. And also, if you have a type of juvenile arthritis that affects the skin, you should really just consult your doctor before proceeding with the treatment. So yeah, that's pretty much how massage helps. Having had a physically disabled child myself, I completely understand that sometimes funding private therapies on a regular basis can be extremely difficult. That's why I offer, cost-effective teaching sessions to parents so that they can learn how to do it themselves. I don't know how many other therapists offer this, but that's certainly another option to kind of reduce that financial pressure as well. But any questions, please feel free to contact me through my Facebook or Instagram, which I believe the links are down somewhere there. And I'll do my best to answer you. But for now, that is all on juvenile arthritis, and I will see you next time. Bye.